As an advanced medical practitioner and pharmacist practicing in family medicine, in today's video I'm going to share with you 6 of my very top tips to help lower your blood pressure naturally. Make sure to stick around to the very end as well, because some of these tips you're never told about. So in clinic, patients are always asking me, what should my blood pressure be? Okay, should it be 125/85? Should it be 135/85 millimeters of mercury? What should it be? Or I got told it should be this number by this doctor 20 years ago, so I've always aimed for that. So I'm just gonna make this bit really simple for everyone who's watching. Ideally, your home blood pressure reading, okay, should average under 130/80 millimeters of mercury, okay? That's the magic number, okay? Anything higher than that, or if you're seeing it's creeping higher than that, that's when you need to take action. You need to speak to your medical provider, because blood pressure is a silent killer. We all know that. It increases the risk of heart disease, heart attacks, stroke. It also causes kidney damage. So it causes so many problems without causing symptoms. That's why we call it the silent killer. So straight on tip number 1, let's talk about caffeine, okay? And to do this, I want to tell you a story about a patient. I had a patient not long ago, male, middle-aged, has a very stressful job, very stressful lifestyle. And when I'm taking lifestyle from the patient, I came to realize that he's having about 10 cups of coffee every single day, okay? If anyone knows what the normal healthy amount of coffee intake is, leave a comment right now, but I'm going to tell you it's about 4 cups a day. You shouldn't really be exceeding 4 cups of coffee a day. To put that into perspective, each normal cup of coffee has about 100 milligrams of caffeine. So 4 cups is about 400 milligrams. For this patient, he's having 10 cups a day, which is about 1,000 milligrams of caffeine, okay? Nearly 2.5 times higher than the recommended amount. So what's this going to do? Well, it's going to increase your blood pressure for about 3 hours, okay? Having caffeine, not just coffee, by the way. So tea has caffeine, energy drinks have caffeine. All of these are going to give you spikes constantly throughout the day, every time you have a cup of coffee, okay? And it can last for up to 3 hours, like I said. So what did we do? We didn't start him on medication. Instead, we did a lifestyle intervention. We cut down his cups of coffee to a normal amount. He was having 4 cups a day. And what did that do? Dropped his blood pressure, okay? So that's a real big one I really want you to think about and think, is this something that I'm doing currently? Can I cut down on the caffeine that I'm having? And for more consistent and accurate blood pressure readings, most of our A&D Medical blood pressure monitors come equipped with advanced cuff fit detection and movement detection, okay? Which means that you're gonna get reliable results even if you're feeling a little jittery after a coffee. And straight on to tip number 2, let's talk about salt. The average adult consumes about 8 grams of salt every single day through their diet. If you know what the normal amount of salt that you should be aiming for is, definitely leave a comment below, by the way. I'm going to tell you, you should be aiming for no more than 6 grams of salt every single day. So in total, 6 grams of salt is about 1 teaspoon of salt, okay? Not heaped, just level, all right? So really think about what you're having. Are you having many processed foods? Are you having many ready meals? All of these are notoriously high in salt, so try and cut down on those. It's all about having whole foods and fresh foods, okay, that you're making at home, that you're preparing at home. That way you can adjust how much salt you put in, and you can put those herbs and spices to bring some flavor in, okay? It's also a really good idea to track your blood pressure to see how much of an improvement this actually makes. And with most of our newer A&D Medical blood pressure monitors, they come with an extra large display. I really like it, it's really clear and easy to read, but this is particularly useful for more elderly patients or those who are visually impaired. And straight on to tip number 3, this only applies if you are overweight, but losing weight can actually help lower your blood pressure, okay? To put some numbers out there, losing about 2.2 pounds, so that's about 1 kilogram of weight, can drop your blood pressure by up to 1 millimeter of mercury, which is pretty impressive, okay? If you do need some help with losing weight, please do check our weight loss videos out on the channel. They can help you lose up to 2.2 pounds, that's 1 kilogram, every single week, and shrink your waistline as well. Now, one of my favorite things about the A&D Medical blood pressure monitors that are Bluetooth enabled is that you can track your results, okay? And you can pair them up with the A&D Heart Tracker app, so it stores your results and you're able to see trends as well. You can also pair it up with our A&D Medical weighing scale. So again, you're tracking the results and seeing the progress, all right? Our app can also connect with your Google Fit and Apple Health Kit. So definitely download it. It's free to download. I'll leave links to it in the description. Straight on step number 4, I can't stress this one enough, and it's all about getting enough sleep, okay? You need to be aiming for about 8 hours of sleep every single night, and try and have a routine when you're sleeping as well. So the time that you go to bed, the time that you wake up, and try and make that routine that you stick to, okay? Having good quality sleep and getting enough sleep is going to reduce our sympathetic nervous system. This is going to slow down our heart, and it's going to reduce the resistance in our blood vessels. All in all, it's going to help lower our blood pressure. And another natural thing that happens when we get enough sleep is our hormones, like our cortisol, a stress hormone, it reduces, our melatonin increases. Again, this promotes our blood vessels to relax, lowering our blood pressure. And if you do struggle with sleep, I'll leave some links in the description to some useful videos and articles with some helpful tips. Let's jump straight into tip number 5. And to do this, I want to tell you a story about a patient of mine. I think a lot of us can relate to this as well. This patient was working about 8 hours a day, and their lifestyle consisted of waking up, going for a shower, sitting down and having breakfast, sitting down in their car driving to work, sitting down in the office and being in front of the computer for 8 hours, sitting down and eating lunch at work, driving back home, sitting down and eating food, sitting on the sofa in the evening, and then sleep and repeat. Okay, now the reason I'm telling you this story is I think a lot of us can relate to that, and this is the importance of exercise, because unfortunately our lives are all so busy these days that we've just got used to that because it's just more efficient and easier. Okay, but if you're not exercising, it's not going to help with your blood pressure. Okay, and we know that just by fitting in 30 minutes of exercise a day, start slow, just go for a walk, try and go for a 30-minute walk every day, try and do a bit more walking in the office if you sat down all day. Okay, doing these little things can really help lower blood pressure. And to put it into perspective, just by doing moderate intensity exercise, so slow building your way up to more moderate intensity exercise, we're going to share some on screen, can lower your blood pressure by up to 5 to 8 millimeters of mercury, which is pretty impressive. Now, whilst we're on the topic of exercise, let's talk about your cuff size as well. This is something really important. With most of our A&D Medical blood pressure monitors, they all come with a wide range cuff size. Okay, that means it accommodates arm sizes of 8.6 inches to 16.5 inch. Okay, this wide range cuff size basically helps ensure that most people have a proper fit, which ensures accurate blood pressure reading. Because believe me, if you're not using the right cuff size, you will get incorrect blood pressure readings. And if you want more information on picking the right cuff size, all the do's and don'ts, we will leave a link in the description below. Definitely do check out our other videos on the topic, because we go into a lot more detail on it. And straight on to tip number 6, if you do drink alcohol, please drink within moderation. Okay, so no more than 14 units of alcohol per week. If you can do less, even better, because we know that drinking too much alcohol can increase your blood pressure. Also, if you are on blood pressure medication as well, drinking too much alcohol can reduce the effectiveness of it. So next up, here's my pro tip that I want to give anyone using a blood pressure monitor, and making sure that your device is clinically validated for accuracy and on what we call the validated device list, which is VDL for short, by the American Medical Association, Hypertension Canada, or the British and Irish Society of Hypertension. Because believe me, a lot of the blood pressure monitors that you can find on Amazon are not on the VDL list, so therefore they are not accurate. And I've personally been using the A&D Medical blood pressure monitors in my very own practice for years, because 1, they're an absolute workhorse, believe me, and 2, they're clinically validated for accuracy by the organizations I spoke about, and this is done through formal studies. And as the inventors of the digital home blood pressure monitor in 1977, A&D Medical definitely know what they're doing when it comes to blood pressure monitors and making sure they're giving accurate readings. And thank you so much for watching our video today. We really do hope that you found this information helpful, learned something new. If you know anyone that will find this information helpful as well, please do share it to them, okay? If you want more information on cardiovascular health and blood pressure, we've got loads more videos on them on the channel, so definitely do check it out. As we always like to say at the end of our videos, A&D Medical, discover precision.